Soon it'll be the new year, and that might mean a new you. The start of the year just might be the time you consider a few nips and tucks. Where do you start, though? How do you choose a plastic surgeon? Here with some tips on choosing the right surgeon is Dr. Beth Collins. Dr. Collins is a double board certified plastic and reconstructive surgeon and has her practice in Guilford. Nice to have you here,
Hi,
Dr.
Teresa.
Collins.
Nice
All right,
to be back.
So you decide you want to go ahead with a procedure.
Yes.
Where do you find a doctor? How do you start?
A lot of people these days are finding their surgeons on the internet, over the web, which is perfectly acceptable, but what you need to make sure of is that that person is board certified in plastic and reconstructive surgery. There are a lot of kind of quasi-boards that have come out, like the Board of Cosmetic Surgery, where you might have somebody who's never done a surgical residency.
Oh, wow.
Yeah.
That could be dangerous even.
Well,
it could be.
You know, it really depends on the person's experience, but you really don't know what you're getting. That person could be fine,
Sure.
but there's nothing that's really vetted them out. When you see somebody who's been certified by the American Board of either Plastic and Reconstructive Surgery or facial plastic surgery, those two are part of the American Society of Surgical and Specialty Boards, that you know that they've been tested, they've gone through a full residency in surgery and haven't taken, you know, a 3-month period where they've watched somebody operate or something like that. Because anything beyond that, is a mixed bag. You just really don't know what you're going to get. And it's not to say that they're necessarily bad at what they do. It's just this vast unknown.
Sure.
So,
and if you're going under the knife, you probably want to make sure you have the best care.
Absolutely.
Tell me the difference between a plastic surgeon and a cosmetic surgeon.
So a plastic surgeon is typically trained globally. So we do everything from reconstructive plastic surgery to cosmetic surgery, you know, where we're treating people who have either injuries, cancer reconstruction, and also learning the cosmetic surgery. So we have a very wide array of training. And then there are those of us who go out and specialize in certain areas. I've branched out more into the cosmetic surgery field. I do some breast reconstruction and skin cancer reconstruction still. And then there are those plastic surgeons who do more reconstructive surgery. When people are going out in the community and saying that they are board certified cosmetic surgeons, you need to find out what their background is. What was their surgical training, if they're not trained at all in surgery. You know, this could be somebody who's an OBGYN who took a course, and, you know, if they're that person, make sure you're looking at their work. But I really recommend getting somebody who's been specifically trained in plastic surgery. Yeah.
So you go ahead and schedule a consultation. What typically happens during the first visit?
Well, you'll meet me, of course, and I'll sit down and we'll talk about whatever you want to discuss. And let's take, for example, you want facial rejuvenation or eyelid surgery. So we'll talk specifically about that problem, and then you'll really want to see my before and after pictures, because you want to see what my work looks like, and if you agree with my aesthetic, because some people have a very different idea of what is the beautiful normal. So you want to make sure that you and I agree on what is right, and that I can achieve the things that you're looking for, and we talk quite a bit about that. And then you meet extensively with my staff to talk about things like pricing and what the day of surgery is going to be like. So before you leave the office, you have a very good idea of what your experience is going to be should you decide to proceed with surgery.
Sure. Dr. Collins, would you say there are any red flags besides double checking on the
board certification? Well, you want to make sure that that somebody hasn't had a lot of citations against them, and you could find that out. It's all a matter of public record.
It is.
You know, there are always things that could come up in a doctor's practice but you don't want somebody who has had problem after problem. That would be one red flag. Also, ask around, because a lot of times there are people's reputations mean everything. And if you have friends who have been happy with somebody, that is your best resource to finding out if that person's really good.
That makes sense. And tell me about the fun event coming up January 16th.
Okay, well, in my office we're doing an eye event where I'm going to talk about and show before and after pictures about eyelid rejuvenation. I'm going to do some live Botox demonstrations. We'll pick somebody from the audience who one or two lucky people get their crow's feet
great.
treated, and a lot of fun stuff. So so if you look on the website, all the
Great, we'll find it
information's
there. It's January 16th, All Eyes on You event. Very nice, Dr. Collins. Let's put the info up on the screen. If you'd like to get a hold of Dr. Collins, you can visit her at 2614 Boston Post Road. That's in Guilford, or visit BethCollinsMD.com. The phone number is right there on your screen, 203-689-5295. Thanks for all the advice.
Thank you so much.
All right, up next, Misfit foodie Jocelyn Tunney shares a gluten-free recipe for snickerdoodles. But first, take a look at this.